All right, guys, Graham Coughlin here with Dr. James Yoder, owner of Onsite-PT. Today we're going to do a little video together. Before we get into what it's about, I'm going to let him tell you a little bit about himself and his company.
Thanks, Graham. So what we do is we help athletes, patients, anyone that's active, try to recover a little bit more quickly from injuries and then prevent them by assessing movement and really honing in on specific deficits to, nobody has more than 15 or 20 minutes usually a day to, if they're going and working out for 45 to 60 minutes, or that's more than most people. So if we like to try and really hone in and be efficient on drills that people need to be doing to improve their movement. Everybody's got different movement deficits, and we can take people through an assessment and specify exactly where their limitations are based on what we know normal human movement, and especially for an athlete, should be, and then provide a program that they can allow their musculoskeletal system to function at a really high level for a long period of time. I work with some personal training companies like Coughlin Strength and Fitness, and seeing some patients, it's a really cool model because Graham has his expertise in strength and fitness, and I think people get confused and think those are the same things, and there's a little bit of maybe overlap, but much different things that we can go after. So when you have two people kind of looking at you and analyzing things, not only can it help you stay injury free, but improve your performance too. And what we're going to talk about tonight, what he's going to go into, is what I see a lot of my powerlifting athletes not spending time on is some of this mobility stuff. And not only are they getting hurt because of it, but they're plateauing. And so that's what we want to get into tonight.
Yeah, so like Dr. James said, we're going to do a little bit about squat mobility today. And like you said before, there's a lot of powerlifting athletes that don't necessarily pay attention to mobility as much as they should. But it's not just powerlifters, it's CrossFitters, it's bodybuilders, it's even a lot of Olympic lifters sometimes I feel like might not pay as much attention to mobility for, that they need to because of the positions they put their body in. So today we're going to go over a couple drills, what you should do as warm-ups for stretching wise and stuff like that before you're squatting to help you keep safe and be able to reach depth and in the squat. So we'll get into it. So if you can't get to depth or your squat just plain sucks, these exercises we're going to show you are for you. You got to be consistent with them though. You got to do them day in and day out. I do all these exercises every day before I squat or deadlift. If you do them once or twice, you're not going to fix your problems. It might help a little bit, but you're going to revert back to your old ways pretty quickly after that. So be consistent and use these exercises, you'll be good to go. So right here we have the test we're going to show is the ankle flexion test. And what you're going to do is you're going to set up about 4 inches away, as you can see right there. And Dr. James will tell you why 4 inches is important.
Yeah, so with this ankle mobility test, very crucial for obviously squatting, that's why we're doing it, but really any athlete. 4 inches corresponds to 20 degrees of ankle dorsiflexion, which is what we have found, and he's keeping his heel down. What we've found that any athlete needs to be able to get to depth, or else they're going to compensate. Oftentimes people don't have pain in their ankle, but because of the dysfunction and the limited range of motion in the ankle, they have hip pain, low back pain, knee pain. And if Graham goes ahead and faces me, if you're watching from the front, what we don't want to see is...
You don't want your knee and your butt to come out and your knee to come in like that. You don't want to come diagonal. You want to come over about your third toe straight forward to do it to the 4-inch test. So you don't want to come sideways. You want to keep your toe or your knee pretty neutral, almost pushing outward towards your third toe when you're doing this.
And the reason we do that is because of the orientation of the ankle joint. It's not totally straight. It's a little rotated laterally if we look at the biomechanics.
Here's a stretch you can do before you're squatting, before you're deadlifting, whatever you want, to help work on that. So what you're going to do is you're going to take the band, step into it, and you're going to put it right around the balls of your ankle. So you're going to come out, get onto a knee, and your opposite hand is going to hold your heel down, and you're going to come forward as far as you can kind of oscillate a little bit in the forward position, come back, back forward, oscillate a little bit, and back. And you're gonna. All right, so the next thing we have, we're gonna work on a little hip mobility. One good test here is to lay on your back and see if you can touch your knees to your chest without having any pain in your hips. So you can do it one leg, keep your leg straight, or you can do it both legs. And if you're having pain in your hips, then this exercise I'm going to show you is going to be good for you. I personally don't have pain in my hips when I'm doing that, but I do this exercise every day before squatting or deadlifting anyways. So there's tension, trying to pull your hips this way. Get onto all fours and keep your hips neutral. You don't want to let your hips go that way. You want to keep your hips neutral against the tension. You can stay in this upright position for a little while. You can do some pelvic flex or arch your back. And come like this, your pelvis back and forth a few times. And then also you can sit back onto your heels and let that band try and pull your hips that way, but keep your hips neutral. Come back up. I like to run through these motions a little bit like this while I'm going. And then another one is keep this knee down and this knee up. And this is going to force you, this one's a little more difficult, especially if you have a really heavy band. It's going to really want to pull your hip this way because you only have one leg on the ground. So you're just going to kind of maintain a neutral position here, not letting your hip get pulled away. And then if you come around front, another one I do is I just turn so the band is pulling me back, trying to pull my hip back. And I kind of just do a couple little hip thrusts forward. Really helps activate the glute and the hamstring, kind of get your mobilizing your hip going backward into the socket. So you kind of come up and like this a few times and then switch and do it to the other. A lot of tightness in your hamstrings when you're squatting or deadlifting. This can be a really good one for you to add in along with the other ones we showed you. So what you're going to do is you're going to come about a little more than shoulder width apart. I like to be. It's more closely to my squat stance. And you have a kettlebell, a dumbbell, anything that you can hold on to neutrally. I have a 35-pound kettlebell, so I'm going to come up with it right here. And I'm kind of going to just let my knees break and let the kettlebell pull me down to stretch, keep me in a good position, and come back up. Just kind of, again, knees break, let the kettlebell pull me down, keeping a nice neutral back, and then come. It's the simple version. If you're having problems keeping a neutral spine and you want to see if you are or if you want to correct them, get, again, a stick, a wooden stick of any kind, plastic stick, and you're going to hold it in your low back, and you want your butt, your head, and your shoulder, and your the middle of your back to be touching. You're going to grab in one hand the kettlebell, and you're going to do the same thing, and you're going to come down. You're going to let your knees break a little bit, and let the kettlebell pull you down and stretch. So what you don't want from this is you don't want your back to round and the bar come up off my butt. If you're doing that, you know that your back is rounding when you're either deadlifting or squatting usually. So you want to keep that back neutral and keep the bar touching when you're doing this. It's touching everything, my back, my head, and my butt. You want to do that. So give that a try.
So we have Graham Coughlin Strength and Fitness, attempting a muscle up. Still thinks he's an athlete.
Woo! Look
Still
at
got
that.
it.
There it is. Still got it.